And welcome to the show. Subscribe at kevinimney.com/podcast. Today, we welcome back Arthur Williams. He's a surgeon and author. And today's Kevin Imney article is an excerpt from his novel, Crooked Ketamine. The excerpt's titled, A Surgeon's Battle with Ketamine-Induced Hallucinations. Arthur, welcome back to the show.
Hi, thank you very much, Kevin. I appreciate the time.
All right. So I think I last had Arthur on about 3 to 4 years ago, and he's a surgeon and writer of novels. So for those who didn't get a chance to listen to our previous episodes, just tell us a little bit about yourself and how you got into writing in the first place.
I'm a surgeon in Cincinnati, Ohio. I've been in practice for over 20 years, and over the past, I would say, starting back 6 or so years ago, I've had some health issues that forced me to kind of slow down, and I've actually retired from practice about 18 months ago. During this time, I've always been interested in writing and telling stories, and being a surgeon or being a physician, and especially a surgeon, you come across some interesting stories. And I think one of the things about surgery and medicine is it's fairly stressful, and this is a good outlet to reduce some of that stress, and it's cheaper than a therapist. Anyway, so that's my interest in writing. I come from a family of writers. My mother was an English teacher as well, so perhaps there's some genetic component there.
All right. So your latest novel is called Crooked Ketamine. There's an excerpt from that novel on Kevin MD. So tell us about this particular story.
Well, it's semi-autobiographical, I guess. When I just to back up a little bit, I'll fill you in on some of my health issues. About, like I said, 6 or so years ago, I was working in the backyard and developed a racing heartbeat.
Yeah.
I thought, oh, well, I'm just working too hard, but it didn't go away.
Mm-hmm.
Went to the emergency room. I was in AFib with RVR and did not feel very well. This all progressed to needing I was in RVR and also had sick sinus syndrome. So I had when I wasn't in AFib, I had a very slow heart rate. So the electrophysiologist recommended I get a pacemaker. And for this, the pacemaker led to more AFib, led to a procedure to try to ablate the AFib.
Mm-hmm.
And then that led to needing a defibrillator. So I've had 4 or 5 procedures, and each time they gave me ketamine as an anesthetic. And each time I had vivid hallucinations or visions. Ketamine is a dissociative anesthetic, and you get this wild out-of-body experiences. The first one was I was on a pirate ship and it was burning. It was just bizarre. I don't know where that came from. But that gave me an idea for a story to tell about a physician, surgeon who's having problems with his heart and he can't figure out why. And that's some of the autobiographical stuff. Part of the book is I was having these experiences and I didn't know why. I was healthy, I wasn't overweight, never smoked, didn't really drink, and was having, just out of the blue, it seemed like, these health issues. And so that led me on a road or a path to try and figure out just exactly what was going on. And in moments of introspection and trying to figure this out, I hearkened back to college where I studied human evolution,
Mm-hmm.
and then medical school, where in college with evolution, you learned of sort of how evolution works to perfect the human species. And then you get into medical school and you say, oh, we're not perfect by a long shot. We have traits that seem to do us in. I mean, just the response to sepsis seemed very curious to me from an evolutionary perspective, or congestive heart failure. The body seems to be working against itself. The blood pressure goes up, blood vessels constrict when the heart fails, and that just sends you into a deep spiral. And there are a host of things like this. As a surgeon, who deals with gallbladders all the time, and appendix appendectomies, these organs seem to be, working against us. And so that led me to think about some of the, as an academic surgeon, some of the anxieties around being a surgeon, and that anxiety leading to the health issues that I had, anxieties about life, anxieties about career, and anxieties about perhaps how I deal with people, deal with different sexes, different races, different religions. What we all have knee-jerk reactions to these things, and it kind of got me down the path of thinking that also not only do we have these double crossing traits that
Hmm.
seem to get us later in life, as a human species we have these double crossing traits that when we were 100,000 200,000 years ago, these xenophobic traits were advantageous to the tribe or to the species. And now that we've evolved, hopefully we've evolved, these traits, these kind of knee-jerk xenophobic or racist or traits, are coming back to bite us.
Hmm.
And so that's some of the themes of the book. It's called Crooked Ketamine, and it's spelled with a K. That gives you some foreshadowing that things aren't as they appear. And there are a lot of plot twists throughout the book. And that's one aspect of the crookedness, if you will, in the title. And then there's the human body's adaptations that we talked about that are double crossing us. And then there's cultural double crosses. So there's a deep and winding path that seems to be crooked throughout the tale.
So let's get back to when you were given ketamine and you had these out of body experiences.
Right.
You dreamt or thought that you were on a pirate ship, for instance. So how long do these hallucinations last? And did it give you insight in terms of writing about these into one of the characters in your book?
Well, the, the self experience that I had with ketamine didn't seem to last very long. 5, 10, the length of the procedure probably at most.
Hmm.
But in the book, I stretched that out. I used a little artistic license.
Yeah.
The very initial paragraph of the books, theorizes that certain people are more susceptible to ketamine than others. And so in the book, the protagonist has vivid dreams on ketamine that seem to go on even longer than what would be expected for the procedure. So the ketamine, my experience gave me the idea, and then I kind of ran with it in the novel.
Now, in terms of your experiences in this book and giving you some of the ideas about some of the crookedness in terms of our healthcare system, how much did your experience as an academic surgeon for decades inform the plot of your novel?
Yeah, that's a good question. In residency, especially, there are a lot of. It's an exciting time. Perhaps when you're on the trauma service, every day, you're encountering these acute life and death situations. I worked after residency. I worked with the VA. There wasn't quite that acuteness, but there certainly were memorable patients and memorable stories,
Hmm.
and those play out through the book as well. I mean, you have to kind of write what you know. At least that's my experience, and I draw heavily on those patients that I remember. Some of the people that I've worked with show up in the book in different ways. There's
Hmm.
no it's not meant to be fully, it's a fiction, it's a work of fiction, but certainly those people that their their characteristics or whatever show up in the writing. It's unavoidable to tell a good story.
Now, ketamine is also used outside of the operating room. I know that there are a variety of psychiatric conditions that are being treated with ketamine. How often do hallucinations happen when one undergoes ketamine treatment?
That's a good question. You're asking the plumber an electrical question. I don't know all the ins and outs of ketamine. The only real experience I had with it was when I was administrating the drug, was
Yeah,
when we were on the burn unit, and the pediatric burn unit they would give during dressing changes and
yeah,
interventions with them would give ketamine, and they would. It's a bizarre drug. It works very well both psychiatrically and anesthetically, but it's for the clinician. It can be unsettling because the patient doesn't seem to be asleep.
yeah.
They can be kind of mumbling or talking during and be completely oblivious to what's going on, but it's apparently, like I said, a dissociative anesthetic. And I think a fair amount of people have the same experience I have, where they have a vivid kind of out of body experience associated with it. But you'd have to ask an anesthesiologist, maybe, or a psychiatrist who deals with it. They could give you a better answer than I could.
We're talking to Arthur Williams. He's a surgeon and author. We're talking about an excerpt from his book, Crooked Ketamine. And that excerpt is A Surgeon's Battle with Ketamine-Induced Hallucinations. Arthur, let's have some take-home messages they want to leave with the Kevin MD audience.
Well, one of the take home messages is that I never really paid attention to was dealing with the stressors in work. Surgeons, but physicians, we have a very stressful job. And some of the, I think if I had a heart rate monitor on during say a gallbladder, which I never really, those were my least favorite operations, you'd have typically a junior resident that you're operating with. And with the more minimally invasive approaches to surgery, as a guiding surgeon, you lose some of the guiding behaviors or guiding instruction, because the trainee is doing the operation. You're not really able to guide them through it. You can talk them through it,
Mm-hmm.
obviously, but they're doing most of the work. Whereas if you're doing an open procedure, you're got your hands in there and you're guiding them as well. So that is losing that control is very stressful,
Mm-hmm.
very, very stressful. And I don't think we as surgeons, we're kind of a macho breed for the most part. And we don't like to admit that might be affecting us. And I know I ignored it my whole career.
Mm-hmm.
I think if I were a chairman of a department somewhere, I'd have a mandatory, wellness program or a meditation session for all the people to be in tune with that. It might have avoided some of the literal heartache I
Mm-hmm.
had later in my career. I think that's the main takeaway from from this book, but in the message that's in there.
Thank you so much for sharing your perspective and insight, and thanks again for coming back on the show.
You're very welcome. Thank you, Ken.